Hello, my name is Kamran Hussain. I am the Anesthesiology Residency Program Director at Geisinger Medical Center in Danville, Pennsylvania. I also serve as Associate Professor of Anesthesiology at Geisinger Commonwealth School of Medicine. Our anesthesiology residency program is a categorical 4-year program with 6 residents per year. We are a quaternary referral center and a level 1 trauma center, so the most important facet about our program is the clinical experience that we are able to teach our residents in those 4 years. In addition to obviously the clinical depth and the variety of clinical cases that we do in our ORs, we also have a very competent and committed faculty with subspecialty training in cardiothoracic pediatrics like myself and obstetric and neuroanesthesia. For us, a typical day for a resident starts around 6:30 when they come to the operating room and set up their anesthesia workstation. But we typically, by and large, make sure that our residents are relieved from clinical duties at a decent hour, somewhere between 3 to 4 p.m. 2 of those weekdays, which is Tuesdays and Thursdays, are dedicated didactic days for the afternoon. The remainder of the days, the early afternoon or the late evening, is the time when the residents review their cases, read up on their cases for the next day, and if they're in-house, they approach the attendings and go over through the anesthetic plan for the next day. We see referrals and clinical pathology so diverse that many places don't end up seeing because there's a lot of competition in the bigger cities between 2 different hospitals. So as a trainee, this is your time to really get exposed to a wide variety of cases. So when you're out there practicing independently, you are comfortable because you have been exposed to some level during your training under supervision, obviously. So I think training-wise, this is probably one of the high-fidelity programs in the region, I would say. The third thing, we're looking for people who are really want to focus during their residency training on the educational aspect. The amount of clinical diversity that you see in these 4 years is exemplary. Pretty much every rotation, pediatrics, neuroanesthesia, cardiothoracic anesthesiology, is all under one roof. So we are not sending our residents to another state, to another hospital to get those subspecialty core requirement trainings, because all of these are offered at Geisinger under one roof. So you're really not transitioning from one rotation to another rotation to a different system, different EMR, or sometimes a different housing option. So this is a very strong point which is not very typical in a lot of anesthesiology programs across the nation.